In this video, we are going to cover all the dermatology related MCQs asked in the MGR University theory examination in March 2024. Hello dear students, myself Dr. Maddineni Srinivas. So let us begin our discussion with the first MCQ. Skin lesion which is circumscribed flat area of the color change which is less than 1 centimeter in diameter. What is it called as? If you have thought of the answer as macule, you are absolutely correct. So in the question, if it was, changed to more than 1 centimeter, then the answer will be patch. So what are the other options? So papule is a solid raised circumscribed lesion, which is less than 1 centimeter in size, but it is going to be a raised lesion, not a flat one. So basically petechia, purpura, ecchymosis, all of them are due to the RBC extravasation, because of which the skin is going to appear red in color, and petechia, the size is going to be less than 2 millimeters, less than or equal to 2 millimeters, and purpura is going to be more than 3 millimeters up to 10 millimeters. So this is about the first question. Next one, fir tree pattern on the trunk is seen in which of the following diseases? And if you have thought of the answer, pityriasis rosea, absolutely correct, because fir tree pattern or Christmas tree pattern are one and the same. And I hope all of you know what is the cause for pityriasis rosea. It is human herpes virus 7, which is going to produce an annular herald patch initially, later on followed by daughter lesions, which are going to be along the Langer's lines, giving rise to Christmas tree pattern. Okay, so answer is PR. Next is causes of the localized pruritus. So the better answer in this question is going to be pediculosis. But if you ask me better, this would have been a multiple correct answer question. But here, if you have to select, you can select pediculosis. I hope all of you know it is due to the lice, and there are three types. It is a head lice, it is a body lice, and pubic lice. So if it is a head lice, the pruritus or itching, pruritus is nothing but itching, is going to be localized only to the scalp. And if it is a pubic lice, the itching is going to be only in the genital area. Whereas the other options, urticaria is going to be due to the mast cell producing histamine, which is going to be generalized pruritus, and psoriasis, it is most of the time only associated with scaling, silvery white micaceous scaling over the extensor surfaces with minimal discomfort and very minimal itching. Okay, so we can rule that out. And coming to eczema, here something interesting. Atopic eczema, we can say that it is localized version, but still eczema, it is not just confined to atopic eczema. There are so many other types of eczema. So that's why we can consider eczema to be both a cause for generalized pruritus and also localized pruritus. So the best option here would be option B, pediculosis. Okay. So the next question is this one. We have discussed this so many times. Sexually transmitted disease. A woman presents with complaint of painless ulcer in genitalia and non-tender inguinal lymphadenopathy was made on examination. What is the most likely diagnosis? So if you thought of the answer as option B, syphilis, you are absolutely correct, because if you remember, we have discussed in our classes the name of the syphilis is better for the disease syphilis. Why? Because in this, both the ulcer, genital ulcer, and also the inguinal lymphadenopathy, both of them, non-tender means painless, both of them are painless. So that's why the name of the disease is syphilis. It is caused by Treponema pallidum. And if you look at the other options, so herpes genitalis, what is the causative agent here? It is herpes simplex virus type 2 more than type 1. And also chancroid, what is the causative organism? It is Haemophilus ducreyi. Remember, in both of them, the ulcer is going to be painful. Genital ulcer is going to be painful. Okay. And also in chancroid, what are we going to see? We are going to see the inguinal lymphadenopathy, which is called as a bubo. And remember, bubos are always painful. Can you name what is the other disease in which we can see the bubo? Put it in the comments below. Granuloma inguinal. So why is it not the answer? It is also called as donovanosis. And remember students, donovanosis, there is going to be not true inguinal lymphadenopathy, but it is going to be pseudo lymphadenopathy. So that is it is called as pseudo bubo in the case of donovanosis. So the answer is going to be syphilis. Next is also a very important topic, vesiculobullous disorder. 30-year-old woman, she is coming with the complaints of flaccid bullae. Very important term, flaccid bullae, which simply means that the patient is okay. Let us see the other question also. So what is the other question saying? So it is a suprabasal split. So with these two clues you can easily mark the correct answer. So remember students, flaccid bullae can be seen in the disorders which are intraepidermal blistering disorders, which could be pemphigus group, in which we have pemphigus vulgaris, which is the most common variant, and also pemphigus foliaceus, and also pemphigus vegetans, which is a very rare variant of pemphigus vulgaris. So how to differentiate? That is the reason why this clue is given. Suprabasal split. Remember students, suprabasal split is very characteristically seen in the pemphigus vulgaris. So option B is the correct answer here. Pemphigus foliaceus, remember the split is going to be subcorneal, below the stratum corneum, because here antibodies are present against the desmoglein 1, whereas in pemphigus vulgaris the antibodies are present against desmoglein 3 more than desmoglein 1. Pemphigus vegetans, though it is a variant of the pemphigus vulgaris, here remember the lesions are not going to be flaccid bullae, they are going to be vegetative lesions. Okay. And one more thing, the desmoglein 3, it is present in higher concentrations in the basal layers of the skin. That is the reason why there is going to be suprabasal split, whereas desmoglein 1 is present in the superficial layers of the epidermis. So the split is going to be present below the stratum corneum. So subcorneal split. Okay. The next question is, erythema nodosum is an example of, it is a inflammation of the panniculus, that is the hypodermis, where adipose tissue, that is a fat, is present. So the answer is panniculitis. Specifically, there will be two parts, septae will be there and also lobules will be there in the panniculus, that is hypodermis. And in the erythema nodosum, remember the septa is going to have the inflammation. So it is septal panniculitis. So there is lobular panniculitis also. Can you tell me what is the name of the disease in which we are going to see lobular panniculitis? Yes, yes. If you have thought of the answer as erythema induratum of Bazin, very good, you are absolutely correct. So these were the dermatology MCQs. I hope this video was helpful. If so, please do hit that like button. Also do subscribe to this channel for more such awesome videos on a regular basis. Thank you so much. Happy learning. Bye bye.